That's the start. Welcome to True Health Tuesdays, and the truth will set you free. Okay, gut-brain connection. Now, we could do an entire month on gut-brain connection, but there's some of the things that I want you to be aware of. Imagine if we kind of knew some stuff about the gut, but not really. Because the current medical system is completely dysfunctional. If you're not familiar with that, when you talk about medical care as being one of the third or fourth leading causes of death, we know that the system is dysfunctional. But let's look at the body as intelligent for just a half hour here. The term phylogenetics is the study of evolution, diversity, and the way different organisms and species relate to each other. Phylogenetics. So now, are we designed to live on the planet? Or are we some weird, unique species that's never been here? We're probably designed to live here. Been here for several thousand years, got tons of evidence of great civilizations that came before us. So what's the deal? What's happening with our population? When we look at about brain damage, okay, literally damage to your brain, this is who you are. We're talking 5.3 million Americans. Alzheimer's kills more people than the cancers, prostate, breast cancers. How come we're not hearing this in the news? $604 billion a year is spent on dementia. Okay, we're only talking 91 is spent on cancer. And you see pink ribbons everywhere. So, they do have like a purple ribbon or something else to say Alzheimer's awareness. But really, what are the modifiable risk factors? What does the CDC state? Okay, now they say the solution seems pretty clear. Increasing physical activity, having a diet rich in fruits and vegetables, maintaining social engagements, and participating in intellectually stimulating activities. I'm in total agreement. So that's ways to keep your brain healthy. Now, what do they say will make your brain sick? Medications, nutritional deficiencies, infections, poisoning, brain tumors, and low oxygen or hypoxia. I'm in total agreement with there too. Okay, so what kind of things are poisoning us? What kind of things are damaging us? Now, is it static numbers or tripling by 2050? Now, that's a big deal. Okay, this means it's not a 20% increase. It's not a doubling. It's a tripling of the numbers of people by 2050. So obviously, if we're looking at the causes, there's some kind of toxicities that's hitting us more. Now, this is a study out of the Journal of Surgical Neurology International that compared 20 countries with the US. It doesn't sound like a fair matchup, but let's just see if the rates of mental disorders in 20 countries are rising at the same. Now, they look for the years from 1989 to 2010. It's interesting that they chose 2010 because that's when they started to force vaccinate all the medical professionals in America with the flu shot. Or you have to wear a mask, which hasn't been shown effective in decreasing the flu. But in order to keep your job and your healthcare professional, you must submit to this product with no liability. But anyway, the 20-country average males, in 20 countries, it rose about 2%. In the US, it rose by 82%. In the 20 countries, females rose 1%. In America, it rose 48%. 20-country average males over 75, it went from 117 to 143%. In the US, it went from 368 to 663. Why? Why is America more toxic? Since we know, what were the causes, the CDC said? Medications, nutritional deficiencies, environmental poisonings. Now, Alzheimer's, now people are diagnosed in the 40s. Why? So what kind, are we over-medicating the population? Could that be it if we're following the CDC guidelines? Or what kind of poisons, what kind of environmental poisons is the population exposed to? Now, they're saying here, petrochemicals, air transport, quadrupling of motor vehicles, insecticides. Insecticides, EMF, we're going to have 5G. Boy, I'm going to do a talk on 5G. That's like crazy. But there are environmental changes. What I want you to own is that there's a structural difference actually happening to the brain. Okay, now this is from chronic traumatic encephalitis and a normal brain. But when we look at this, if you look at Alzheimer's brains, you look at autism brains, you can look at all of these brains, the structure of the brain has actually changed. Now, this is really important that you understand this because there's a plastic effect to the brain where you can change the shape of it. I mean, there's studies in the Rwanda massacre where kids that were born under stress, the cerebellum was huge and the frontal lobe, which is involved in impulse control and more complex thought, was small. Because these kids were just like anxiety and stress because the mothers were anxiety and stressed during the growth process. When the kids were born, if they were in a safe environment, the brain turned into a normal functioning brain. But so see the healthy brain on the left? When I was doing brain sections inside of the lab, getting ready for a test, a chiropractic neurologist walked by and looked at those slight discolorations and told me, wow, that person had a lower left limb dysfunction. And I was blown away because, I mean, I can see little discolorations and we're going to mark things like the hippocampus, amygdala, all the little structures in the brain. That's what they matter. But he was able to see that this person had a lower left limb dysfunction. He couldn't see the cadaver that he took out of that had a healed lower left limb amputation. So this is important because when we're talking about damage to the brain, when we talk about regenerating the brain and reversing the damage, understand there's a plasticity to the brain, but it's all based on stimulation up to the brain. So what are the modifiable risk factors for brain damage or for Alzheimer's, dementia? Physical trauma, absolutely. Medications, this is going to be prescription, even over-the-counter medications. And I mean the really nasty over-the-counter ones like Dayquil or NyQuil, okay, the really deadly ones. Heavy metal poisoning, okay, where are we exposed to this? Dental, vaccinations, environmental, hormonal imbalances, emotional stress, sleep disturbances. Do you know how many people with chronic illness, chronic injury, I say, how do you sleep through the night? And they say, damn, I sleep great. I wake up refreshed, ready to take on the day. I don't know why I have this chronic illness. Does that sound like BS or what? Yeah, no. You can't heal if you're not sleeping, okay? So let's look at this autonomic nervous system, and I want you to own this because this is the fight or flight system, or it's the rest and digest system. See, our whole being is to adapt to environmental circumstances. And if you understand, if you're being chased by a tiger, you don't want blood supply going to the gut. But this is more important than you could imagine. We need a balance of these systems. So if someone cuts you off in traffic, the sympathetic fires off. This means adrenals are going to fire off and thyroid's going to appear low. If you want to regenerate tissue and rebuild the body, then the parasympathetic has to kick in. So this system is always changing throughout the day. Now, parasympathetic is generally activated at night. Physical, chemical, or emotional stress will activate the sympathetic. Now, it controls everything. It's going to control pupillary dilation. I mean, when I was a really nasty instructor, I've changed much for the better now. I would ask these students and I'd go in, okay, what's the connection between the hand and the eye? And, you know, like right now, who wants to be picked on? Nobody. It's like, God, I don't know. I hope someone knows the answer. Please, I'm not going to look at the teacher. I'm going to look at my paper. You know that? Okay, so I'd pick somebody with light-colored eyes and I'd pinch between their index finger and their thumb and I'd go watch his eyes. 1, 2, 3, and I'd squeeze and the pupils would dilate. And then everybody would say, wow, that's really cool. And so then I'd talk to him in like doctor stuff. Okay, what happened to his heart rate? Well, pupillary dilation is under a sympathetic control, so his heart rate just increased. What about blood supply to the gut? Well, that decreased. What about his blood sugar? Well, that increased. What about his immune system? Well, that decreased. All by pinching here. That's it. Okay, so this is responding to the environment instantly. And I mean instantly. But if you're under a chronic influence in this, a chronic sensory stimulus, you're going to end up with chronic illness or disease. Now, when we look at this, Comprehensive Physiology Journal, Autonomic Nervous System and Integrative Physiology, an evolving state of cooperation, it orchestrates. It has every function in the body. You live your life through your nervous system. And this is why people will come in and they'll say, Man, doc, I was diagnosed with high blood pressure. Okay, what's broken if you got high blood pressure? Nothing. Nothing is broken. You are in a chronic sympathetic dominant state, 100 times out of 100. So what do you tell the person? We have to find the physical, chemical, and emotional stressor that's keeping you in the sympathetic dominant state. How are you sleeping at night? What's he going to say? Yeah, great. Great, I get up 5 times a night to pee, I feel kind of tired when I get up, you'll get all these responses. But this is more important, because when we're talking about brain function and we're talking about altered physiology, understanding the regulatory mechanisms between sympathetic nervous system, parasympathetic nervous, and immune system is critical for understanding chronic disease and immune system associated changes. Chronic disease. Then we go back. So what kind of things are listed as chronic inflammatory diseases? Neurodegenerative disorders, Alzheimer's, Parkinson's, depression, PTSD, all of these. We can also add in MS. We can add in all of these degenerative conditions. What about pain? Let's just take pain. Has anyone in here heard of what are the drugs that they give that they make in Afghanistan? Opioids. Good job. Okay, thanks. I forgot about that. Okay, so now the opioid epidemic, is this because people are just finding them on the ground? Or has the medical community completely dropped the ball and you got pain? Well, your body must be stupid, and I'm too stupid to look at your structure. So I'm going to give you an opioid that's highly addictive, and it's going to cover up your awareness of the symptom. Yes. Ashley, order me my white jacket. I feel so superior. Instead of saying, good God, your body's intelligent, it's given symptoms for a reason. I have no clue at structure. I'm going to send you to the chiropractor. They're real good at this. Okay, that's the world of the future. The problem is, if you cover up the problem or symptom of pain with a drug, do you still have the problem? Survey says? Yes. No kidding. Why is it so simple and common sense? So here, you got pain, you're taking a drug for pain, you still got the pain, your body is still being affected by it, you're in a sympathetic dominant state. Does that make sense? That means 100% of people in the opioid epidemic are in a stressed state. They're stressed because they got some kind of pain, and second, they're stressed because they're chemically addicted now to a substance that damages their brain. Pain of 6 months duration alters the structure of the brain. 6 months. And we have patients in here saying they've been suffering for 10 years. Just had a guy yesterday with back pain for 40 years. 40 years. Okay, 6 months of pain shrinks the brain equivalent to 10 to 20 years. The longer a person has pain, and I'm just talking pain, it could be physical, chemical, or emotional pain, actual changes in structure of that brain. I mean, we should be picking up pitchforks and storming anyone that passes out opioids unless they know what the problem is. Okay, it's important to emphasize the importance of treating pain early and aggressively, or it will destroy the brain. Treating pain, how about finding the cause? That would be really good. Now, this is huge. This is a he was diagnosed with multiple sclerosis, but when we understand that's a problem with the brain has a neuroplastic effect where the brain can change based on stimulus. Do you think, and this is a person standing up, you can see a change in structure from the left one, which is the original one, and the right one, which is the post one. Can you see this change in structure? That's going to alter input into the brain, and it got his brain working better enough to where he could use his hands. Okay, when we look at this patient, again, you can look at the structure. Now, this person was diagnosed with a low-functioning thyroid, indigestion, okay, and high blood pressure. Under a sympathetic dominant state, your blood pressure will elevate. Under a sympathetic dominant state, or the fight or flight state, blood supply to the gut is decreased. Okay, under a sympathetic dominant state, the adrenals are going to be in a hyperactive state and the thyroid's going to be low. Does anybody here think that he had any of these conditions? Or do you think that he was in a sympathetic dominant state? Okay, welcome to my world. Okay, we're not diagnosing anything. We're looking at the body's response to the environment as intelligent. Does that make sense? It does to me. I mean, of course, you know, the change in structure was neat because that's going to alter the brain, but you have to deal with not just the structure. You deal with the physical, chemical, and emotional stress. So do we get them on plants? Yeah, you're going to start eating plants. Do we have him do the neurolinguistic programming to change his brain? Yeah, absolutely. Did we get him to deep sleep? Absolutely. And, you know, gets better. This is everything. Now, when we're talking about stress, fight or flight, that shuts blood supply down to the gut. Now, this is huge, but we got to understand that plastic effect. Now, you've got this brain at the back, or the cerebellum. They used to think that it wasn't that big a deal, but think it every time you move something, every time you move your body, that goes up to that cerebellum, that stimulates it. Now, what they're finding out is this thing isn't just for motor control. It controls the frontal lobe. I know. Person in the back's going, whoa, controlled in the frontal lobe. I know, man. Okay, we're talking depression, anxiety, bipolar disorder, schizophrenia, all the complex functions. So movement can help with the brain. That's mind-blowing, because that means that like exercise will actually help regenerate the brain. That means that if you take a toxic chemical to deaden your awareness of your body or brain, you're going to alter brain function. And this was back in March 2017, but they're finding out it's the controller, the creative capacity, the cerebellum. And again, this baby back here is stimulated by movement. And we even get people like with multiple sclerosis, schizophrenia, depression, we get them on cross-crawl exercises to get both halves of the brain to fire off. Complex role in executive function, creativity, attention, planning, emotional regulation, reward-seeking behavior. Dysfunctions of this, schizophrenia, Tourette's, autism, Parkinson's, addictions, OCD, bipolar disorder, depression. That's dysfunctions of the cerebellum. Now, of course, when we talk about, adjusting, because what we're doing when we adjust the body, we're altering brain function. We're altering brain function. So if this will alter brain function and you adjust and get it over to this, can you see that there'd be a change in sensory input into the brain? Like, duh. Okay, so this is an interesting byproduct. I wanted to bring this gal up because before the surgery, and those are massive steel rods and bolts and stuff, and before this, she was able to carry a box of concrete across her yard. I mean, not a big box, we're talking like a 20-pound box, okay? Not a 90-pound sack. She's not a bear. She only weighs like 120 pounds. But then the surgeon was saying, look, hon, you got a slight scoliosis. You're starting to get a rounding of the shoulders. And you're 70 years old, we really got to do the surgery now. We don't want to do it when you're later. So we talked her into it. Now, what's happening now, you can see the side view, the x-ray on the left, is a side view of her neck. Well, she was so bad with the full-on fused surgery, she started to develop this Parkinsonian shake. Because if you're limiting motion of those vertebrae, you're limiting information into the brain. So the body is going to trigger movement in order to get more information into the brain. Welcome to Parkinson's, because movement triggers dopamine, but it's just getting sensory input. So if you alter that, you're going to alter the input into the brain. Now, what was mind-boggling, I mean, there's not much to adjust on her, and he didn't need to fuse everything. So she went back to the surgeon because she was hurting. I mean, there was a bunch of nasty symptoms. So they took out all of the steel, and then they put more steel back in because they actually removed part of the bone. And so you can see in the neck, they removed all of those bolts, and that's her neck without the bolts, which is, it's better for me to work with, but at least we can get a little bit more stimulation into the brain. So look at this area of the brain. Now understand, it has a plastic effect. It can change. It can change based on the stimulation in. And this is super important when we bring up the vasovagal aspect of it, or the vagus nerve, how the sensory input goes in. The cerebellum is that little guy in the back. You can see like little lines on it. Do you know what they're called? No. This is kind of cool. It's called Arbor Vitae, the tree of life. I know, isn't that cool? There's so many neat things when you look at anatomy and stuff. It's just like, God, these guys were right on. And so that little brain, 80% of the neurons or the nerve cells are inside of that little aspect. Okay? So why is it 80% of those nerves? See, when I started this about phylogenetics, or genetics, when we look at this brain has adapted to survive on this planet. 80% of the neurons are inside of that little cerebellum. However, it only has like 20% of the volume of the brain. So why is it so concentrated? Why is every input going into that? And why is that little brain controlling the frontal lobe in order to have impulse control or allow us to deal with the environment? And if those signals are altered, we got schizophrenia, bipolar disorder, and frontal lobe dysfunction, Alzheimer's, dementia. So now when we look at this, the gut-brain connection, and I know I'm trying to bring it all in, and which is impossible in a 40-minute talk, but when you look at the gut-brain connection, that base of the brain, right up there in the parasympathetic, you got 12 cranial nerves. One of the cranial nerves, it's called the vagus nerve. Now, it controls everything in the gut. It controls the movement, okay? It controls the acid secretion. It controls elimination. It controls all the breakdown process. Is that a lot? Little tiny nerve. I mean, does all this stuff. That's only 10% of its function. 90% of that vagus nerve, 90% of that one nerve that comes off of that parasympathetic is sensory into the brain. Why? You want to know? So do I. I mean, there's a lot of theories about it. There really is. But when we stop all this crap with the pharmaceutical and vaccines and chemically altering your body with drugs that are toxic and dangerous, and we start really understanding the nature of how we're designed to live on this planet, people are going to be a lot healthier. But let's just propose this just for a little bit. Since you're taking something in, and 90% of the nerve that's responsible for breaking that thing, could be an apple, could be a banana, okay, could be a twig. Okay, you're breaking it down to protein, fats, and carbohydrates. That's what you can't break down. You eliminate out the poop chute. There's no kids in here. Okay, good. Oh, sorry. Poop chute, I meant rectum. Okay, so you're breaking it down. What you can't break down, you eliminate. Okay, but why? Why would so much of that information of that nerve be sensory input into the brain? Maybe because we're in the environment. What if you're eating rotted flesh or you can taste the fear aspect in that animal? Do you think that the brain may need to respond with a sympathetic dominant state? Or what if you're eating bowls of fresh fruit that you don't have to capture? Okay, do you think that your brain is going to be in more of a parasympathetic state? Does that make sense? So the gut-brain connection is huge. We're just not sure of it. There's also a number of theories called a polyvagal theory where this goes in and innervates a lot of the aspects of the face. And so when you have that gut feeling, that's actually where a lot of the neurotransmitters are produced in the gut. But it also makes sense too that your social interactions are based on that vagus nerve, which is also supplying a lot of the face and its reactions. So this is like the mass-faced appearance of Parkinson's. So there's a whole bunch of things that we're going to go over and explore. Just realize that this is an unusual aspect. 80% of the neurons are in that cerebellum. 90% of the nerves that govern the movement and intestinal function are actually in sensory. So now, the enteric nervous system, they call it the gut brain. This is all the intestinal tract down there. And you're talking 100 million neurons. The second brain can control gut behavior independently of the brain. How does that work? How does that work when you're taught that you have a cardiovascular system, digestive system, musculoskeletal system, neurological? I mean, you don't have one being. You don't have one being that has these interdependent systems. Okay? If you thought that your brain and body were interdependent, would you treat your body differently? Or would you go to the gastroenterologist who hasn't a frigging clue at neurology, or doesn't know anything about digestion and doesn't know anything about gut flora? Okay? He's just looking for diseases. Now, the gut-brain axis is bidirectional communication between the central and enteric nervous system, linking emotional, cognitive centers of the brain. Emotional and cognitive centers. Now, gut dysbiosis, this means the intestinal tract, where you have 2 to 3 pounds of bacteria, that if you have a problem with that bacteria, it will cause central nervous system disorders like autism, anxiety, depression, and functional gastrointestinal disorders. Can it be that dramatic? That we're not altering the actual intestines. We're not doing a gastric bypass. We're just changing the bugs inside of our intestinal tract. We're altering that normal microbiota, that flora. And this is negatively affecting brain function. So they got a bunch of studies like this, but this one's really cool. At a Trends in Neuropsychiatry. Psychobiotics and the manipulation of gut bacteria and the gut-brain signals. So they get these group of mice. They birth them in a fairly sterile environment. They give them food that's sterile, so their gut doesn't have the normal microbiota. Okay, and they expose them to stressors. And they watch their behavior, because mice have normal behavior, mice have abnormal behavior. Yeah, anybody want that job? Okay, my nephew is a brilliant researcher, and he can show you to play with mice and to dispatch them and to look at their brains and intestinal tract and just, yeah, Marcus is a brilliant guy. But it's not my field. But when you look at this, they're checking these mice for how they respond to the environment. Psychological effects, emotional and cognitive processes, glucocorticosteroid response, inflammation, and abhorrent cytokines. Cytokines are their cells that respond to certain things. But inflammation, so they're talking about inflammatory responses. Inflammation, do you understand inflammation is not a dragon attacking you? Inflammation only occurs under tissue damage. So if you hear someone say, man, you got inflammation, okay, they should say, man, you got tissue damage. Okay, what's damaging that tissue? Because that's more important. And then you don't just take a drug to reduce inflammation. That's stupid. Pro-inflammatory cytokines share a strong and well-studied positive association with psychiatric conditions as depression. So pro-inflammatory cells that are seen around inflammation, are associated with psychiatric conditions. Let's just see what they found. Now, if they took mice with similar aspects of Alzheimer's, and they changed the gut flora. You understand, they're not doing anything other than changing the gut flora in the intestinal tract. On Alzheimer's disease, increased cognitive function, decreased inflammatory cytokines. So they, just by changing the bacteria in the gut, it decreased inflammation. What about Lou Gehrig's disease, ALS? Decreased motor neuron death. That means that by changing the gut bacteria, neurons in the brain didn't die as fast. What about autism? Decreased pro-inflammatory cytokines, decreased anxiety, decreased repetitive behavior, increased communication. So when we look at the gut-brain connection and we're looking at environmental stimuli, okay, by changing the gut flora, you're altering brain function. Bacterial infection, you add more bacteria to the gut. Okay, wait a second. So if we're looking at this, we're adding bacteria and stuff. Does this mean that if somebody takes an antibiotic, it can have suicidal thoughts? Yeah, welcome to Cipro. Okay, diabetes, okay, by changing the gut bacteria, decreased glucose, post-inflammatory anxiety. I mean, it seems too easy. So what's damaging our gut flora? Well, we got GMOs. We got the glyphosates. That's been around since the 90s, 96. And this is destroying our gut flora. they're a mineral chelator, and they destroy bacteria in our gut. So that's one. Now let's see about non-antibiotic drugs. How about statin drugs, cholesterol drugs? So when we're talking males 75 years old and over are affected 3 times more than females with dementia and Alzheimer's, do you think they're taking more cholesterol drugs? Yeah, or blood pressure drugs. Yeah, we got a polypharmacy thing. But it's interesting, it's not just cholesterol lowering drugs. It's most of the drugs out there can have a negative effect on the microbiome. So we're talking antacids, we're talking everything. This was a great study about statin damaging the gut function, which makes sense. This one, when we look at that vagus nerve, again, that input from that vagus nerve, it controls mood, immune system, digestion, heart rate. And if you can change that stimulation, how do you change the vagus nerve stimulation? Well, if your neck is off and it comes out of the top of the neck, that adjustment can alter parasympathetic activity. That we know. But also, there's more of the sensory input into the brain. So can we alter the vagus nerve by affecting the intestinal tract? Yes or yes, you can. We've seen that. You change the microbiome, but it can't be that easy. If it was, people would be taking probiotics, they would be eating healthy bacteria. This would be passed out in all the hospitals. But we're looking at depression, post-traumatic stress disorder, inflammatory bowel disease. Now, since we know most of the drugs out there can negatively affect your intestinal tract, remember, you put that broccoli in your mouth, it goes into the stomach, into the intestinal tract, into the large intestine, gets broken down. You put the Tylenol, or Advil, or Motrin, or Aleve, or Depakote, Wellbutrin, Synthroid, the bioidentical hormone that's not identical, okay? You know, you put everything in your mouth, it has to go into that intestinal tract, and it'll either positively or negatively affect it. Now, for generations, our intestinal tract is designed to communicate to the outside world. That's why 90% of the information is going to the brain. Could those medications or toxic chemicals, like let's say you eat a burger. Now the burger came from a sick, tortured animal that was loaded up with genetically modified Bt toxins in the corn, and then it has bread that was soaked in glyphosates, but don't worry about it. They put a little MSG in the hydrogenated vegetable oil that they called mayonnaise. So it tastes freaking amazing. Okay, you put this crap in your mouth, okay? I know, crap is supposed to come out here. You're right. You're right, okay? But this stuff I wouldn't really consider food, okay? But it goes in your mouth. Do you think that's going to negatively affect the gut? Absolutely, absolutely. So increased intestinal permeability are markers for Parkinson's disease. So when we see leaky guts, and we see them all the time on x-ray, I mean, when you're looking at an x-ray, you got the ascending colon on the right. It should be about the width of a stool. You should see the transverse colon, you should see the descending colon, and it should be a standard width. You should be able to see it. I see them instead of a standard width, like this. I see it encompassing all over the gut. I see, it looks like people have been shot with shotguns. I mean, it's mind-boggling. Why? Well, one, the measles, mumps, and rubella. But I mean, we're talking all the vaccines, they cause inflammatory cytokines because damage to the gut or damage to the, cells. Just the MMR can cause a form of inflammatory bowel disease. So does this mean that this can alter brain function? Absolutely. Absolutely. What about the 72, or actually this one, 69 doses of 16 different vaccines? You're right, Ashley, I need to update it. It's now 72 doses of 17 different vaccines. But of course, if I do this next year, it'll probably be, you understand? Okay, so when you get these people that says, well, I was vaccinated, I'm just fine. There's no reason my grandkids shouldn't get it. Well, really, okay, when you were a child, there was a liability on this. Okay, and they even had to change some of the vaccines because they knew that it's causing so much damage. But since 1986, they passed a law. So these companies have a liability-free product that's forced on the population. Anybody think that's fair? Anybody think it's fair? I mean, if you're saying, yeah, herd immunity, really, look at our herd, okay? If you look that most vaccines have an effective range okay, where they can decrease the disease of between 4 and 10 years, how many people in this audience have not had a DPT shot in the last 5 years, 10 years? Yeah. Okay, so you are all breaking up the herd immunity. Okay? I'm sorry. So it's not just the kids, you know. We got to shoot everybody. Okay, except when we look at populations in China that have, you know, you're talking over 95, 98% coverage, they still have epidemics. The flu shot season's coming up. Dr. Hugh Funderburg says if you receive 5 consecutive flu shots, your risk of Alzheimer's is 1,000% higher. Okay, why? And then we got patients in here that say, well, you know, I got to get the flu shot. Okay, don't get the one with the growth medium of monkey kidney, dog kidney, aborted human fetal-cellars, or the caterpillar larvae. Okay, in the multi-dose, because those are, the caterpillar larvae is not cancer causing that we know of, there just haven't been long-term animal studies, but the other 3 are neoplastic cells which can cause cancer. And if it's a multi-dose vial, it's going to have mercury and other preservatives in there. Get the single-dose chicken egg version, so that way you're only getting aluminum, which is extremely neurotoxic too, but at least it's not cancer cells, although it's not tested for mutagenesis. Aluminum, oh damn, this is in that single version one. Well, anyway, okay, it's also in all the other ones too. Long-term brain inflammation. Let's read that backwards. Is inflammation attacking you, or is it the result of tissue damage? Tissue damage, okay? So, aluminum adjuvants, serious immunologic disorders, long-term brain damage associated with neurologic complications. Too many drugs, the average person over 60 is taking 12, but these drugs can cause mental decline. Why do they cause a mental decline? Is it just because that chemical goes in here, gets in the bloodstream, and it's toxic and can damage the brain? Or is it because it's destroying the gut flora that has 90% of that nerve into the brain? Go on, say it with me. Wow. That's okay, we'll work on that the next slide. Okay, okay, so they understand that there's inflammation in the brain of people with Alzheimer's and dementia. They do, okay? I mean, you can see it on a brain scan. Okay, so then why not? Wait, inflammation, is that something attacking the body, or is it tissue damage? It's tissue damage. Okay, so you guys are obviously smarter than the guy that developed this study, because he thought, ooh, inflammation, take this non-steroidal anti-inflammatory. Okay, well, it turns out that it made it worse. The study doesn't approve the theory that inflammation is a factor. Tissue damage! Okay, negative studies like this fail to prove the hypothesis, leave thousands of questions unanswered. Yeah, find the tissue damage. Find out what is damaging the brains. Then we look at this. Tylenol, Excedrin, Nitol. A medication as benign as decreasing your awareness of the environment and causing, decreasing your awareness of the environment. That sounds like pretty friggin' major, doesn't it? Yeah, so it's going to knock you out. It turns out that it causes cognitive decline. Oh, and if you do have Tylenol or any of these, Tylenol's one of the worst ones, but there's not a really good one. You figure things that cause you to sleep, you get an average of 12 minutes more sleep a night. Okay, watch our video on sleep restrictive therapy. 5 days you're sleeping through the night. Okay, statins cause it. So here we go, sharpagain.org. This is a really cool site. And look at what they say to do in order to fix your brain. Heavy metal and mercury and other heavy metal poisoning. Avoid it. So this means, of course, they're not saying it on their site, this means all vaccines, choose another way to strengthen your immune system. Prescription medications. Find out what's wrong and fire the doctor that gave it to you, or tell him to become an expert in treating humans. So instead of drugging the symptoms, he can actually find the problem and fix it. Yes, Ashley, I was raised in a sarcastic environment. God. Stagnation and inactivity. Why? Because that cerebellum gets information up from the body. Thyroid and other hormonal imbalances. They're not hormonal imbalances, endocrine disruptors. We're exposed to it. If you drink out of plastic, if you have any other aspect that's disrupting, endocrine disruptors, they're in shampoos, they're in soaps, they're in food products. Inflammation, again, tissue damage. Anything that harms a tissue is bad. Artificial flavors, colors, sweetness. I mean, nutritional imbalances. It seems too simple. But what you have to do is go back and realize that we're genetically designed to live on this planet. Anyone got a problem with that? Yes, Star Child. I don't know, maybe we just beam down. But you got to get your nervous system checked, stop the neurotoxins, fix the problem, work with the doctor to eliminate the drugs. So if you got a doctor that's just drug and symptoms and he's completely unaware of the gut-brain connection, he's doing you a disservice. He needs to really be educated on this. Gluten-free and dairy-free, that's only because we have poisonous gluten that's only been around since the 70s, and then it became ridiculously toxic in the 90s by spraying glyphosates on it. Juicing and blending, why? Because that pre-digest the nutrients, plant-based organic, get deep sleep, reprogram. But when you look at this, probiotics, can it really be that simple? Recent studies demonstrate that probiotic bacteria have beneficial effects on the brain in improving the intestinal barrier function. It seems too simple, but when we see the mouse studies and we see it correlate. Exercise. Why is exercise so important? Movement stimulates that cerebellum, and this can cause an effect. This is why we give symmetrical movements to everyone. And I got to tell you, when you get a kid with attention deficit disorder, I'll have them sit on the exam bench and have them just swing their legs, and I'll say, swing them even, buddy. And within about 30 seconds, they're not swinging them even. Okay, and I tell the parents, I said, this is damage to the brain. He has a poor communication between both halves of the brain. And, you know, was he fully vaccinated? Okay, did the mom get Pitocin? Did he have ear infections? All of these damage the gut function and brain. And then, you know, we go through and get him help. Exercise and dementia. Why would this help? Because you're stimulating that cerebellum. So is movement important every day? It has to be. It should be a nutrient. If man makes it, don't eat it. Berries, food, fruits, all of this stuff. And if it's organic, you're getting healthy bacteria in there. So ferment this stuff. Get fermented everything. Eat fermented foods with every meal, but you got to get your nervous system checked. Glutathione. What's the one thing that Tylenol depletes? Glutathione. What's the one thing that protects your brain? Glutathione. What's the number one drug prescribed by doctors today? Tylenol. What's the deadliest thing for your brain? Tylenol. Maybe it's just a random correlation. So when we put this up and we talk about healthy nerve supply, why? Because you live your life through your nervous system. You got to get it checked, and you get it checked through a heart rate variability, a rolling thermal scan, surface electromyography, a set of digital x-rays so you can see, you know, the altered proprioception. That's what we do. You find anyone that does half of that or more of that, fantastic. And you just find anybody that doesn't do any of it, fire them. Find somebody that's a real doctor. Regular exercise. Why? Because it helps the brain. Proper nutrition, sufficient rest, prayer, meditation. We got videos on all of this stuff. But if you take care of your brain, and if you got brain damage now, you can regenerate it. And then we got, check out Extreme Health Academy. I think all the cabins are filled up for the cruise next year. But man, check out our site. If you want a wealth of information, I mean, we're talking researched articles after research articles. The disease database in here is phenomenal. I mean, it's incredible. Then we got multiple references. I put multiple references at the bottom of this, not just for internet trolls, but for people that want to actually learn. Okay, the numbers don't correspond with some of the references, okay, that I have. I didn't have time to go through that. But these are all fantastic references just to look up. Because when we look at, when I look at a journal article that states something, I look at their references and the references of the references, then I finally get down to the studies, and then, you know, I have a good understanding of what they're trying to put forth. And make sure, if you can, this J.B. Handley book, How to End the Autism Epidemic. I'm only 40 pages into it, and the reviews are out of this world. But you're going to see the criminal aspect, okay, of what's going on with the vaccine court, okay, with the special masters, how people have been caught on stand lying to throw kids out that have actually been damaged by the medical procedure that's forced on them. And there's a lot of people in there that are trying to get this under the carpet, but eventually it's going to be out there. Okay, it has to be. But his facts, data, and support are out of this world. Okay, next week we're going to expand more on the brain. And next week we're going to be taking a bunch more questions. Or actually, we're going to take questions next week. What time is it? 7:46. I can take 2 questions. Any questions? Yes, sir.
I'm just curious, what's the brainstem? Is that related to the cerebellum?
What's the brainstem? The
Yeah.
brainstem's on the inside. It's the primitive aspect of the brain, and that's where the medulla, then you got the pons, you got the cerebral columns. That's all in the brainstem, and that's like cardiac and respiratory and basic functions. Oh, cool. What about multi-level marketing products like Plexuses? Are they actually healing the gut? I don't know. Multi-level marketing products I get scared of. I mean, honestly, we only have 2 here, but I went to the factories, and those guys, I mean, I pretty much, some of them are good. When you're looking at products that help with the gut flora, look at the source of it. If it's organic, plant-based, and look at the bacterial count, prebiotics and probiotics. There's a site called the drwithin.com, and Dr. Tim O'Shea's got a number of good products to rebuild the gut flora. That's awesome. But Mercola has got great products. Natural News, I respect him really well. There are going to be good products. Yes, ma'am.
Do you have on the lectin-free diet, so do you have an opinion on it?
The lectin-free diet. I'm going to actually read that on my next book. Some of his data is really, really cool. Okay, it's pretty exciting. So when I read the book, I'll be able to comment better. Okay, yes, sir.
More about inflammation. Chronic inflammation is bad. Inflammation is a healing response.
Mm-hmm. The difference between chronic and acute inflammation is the amount of tissue damage. Inflammation only occurs under tissue damage. That's it. And inflammation's a healing process. Like you got these cytokine 10 cells. Okay, and cytokine just means cells. It's just a fancy way to make people sound smarter. Okay, but the cytokine 10s build tissue. Those things do not get initiated until you initiate the inflammatory cells or the cytokine 6s. Because you're not going to just rebuild cells unless you slough off some old ones. You got to clear off the old building first. So chronic inflammation means that you got chronic tissue damage. You got tissue damage from multiple different areas. And that's where you get the systemic inflammation. That's where all the joints in your body hurt. That's because the blood is too thick. There's low stomach acid. You're not building healthy blood, or you got poor digestion, or nutrient deficiencies, or toxicity, or you're dehydrated. All of that stuff creates the body to not regenerate tissue fast enough, and then you get the systemic inflammation. But it's from tissue damage. And acute inflammation is fantastic. That's how everything works. I mean, if you go in there and cut yourself, you're going to have an acute inflammatory response, regenerates tissue. A week goes by, bam, brand new skin. I mean, that's cool. I like being human. Okay, so next week, more cool stuff. Thank you very much.